Good morning. The mucus is often worst when you first lie down at night. No matter what you try, warm water, honey, lemon, or other home remedies, it keeps coming back. What surprises most people is this. In the majority of patients I see with this exact problem, the throat is not actually the source of the mucus. Something happening elsewhere in the body is triggering it. Unfortunately, many people, and even some healthcare providers, never identify the real cause. Today, I'll explain what is actually behind persistent throat mucus in adults over 60, why common treatments often fail, and what practical steps you can start taking tonight. I'm Dr. Favor Adme, and this channel is dedicated to sharing the latest research on senior health in a simple, practical way. If you haven't subscribed yet, consider doing so to stay informed about future topics. Let's begin with one of the most common causes of persistent throat mucus in adults over 55. Most people who have this condition experience no heartburn, no acidic taste, and no obvious chest discomfort. That's exactly why it often goes undetected for years. By the time it's finally recognized, constant throat clearing has usually become an ingrained daily habit. Once you understand what's really happening, your symptoms may start to make much more sense. Your throat and voice box naturally produce mucus all the time. Under normal circumstances, you swallow about a liter of mucus every day without even noticing it. You only become aware of it when the amount increases or when it becomes thicker, stickier, and more difficult to clear. The throat doesn't produce extra mucus without a reason. It does so as a protective response. When the tissues of the throat, voice box, or back of the nose become irritated, the body produces more mucus to coat and protect them. It's the same process that causes a runny nose during a cold. The body is trying to shield and flush irritated tissues. What many people don't realize is that the source of irritation doesn't always come from above, such as allergies, infections, or environmental factors. It can also come from below, from the stomach. This condition is called laryngopharyngeal reflux, or LPR. You may already be familiar with acid reflux or gastroesophageal reflux disease, GERD, where stomach acid travels back into the esophagus and causes heartburn. LPR is a less obvious form of reflux. In LPR, stomach contents travel even higher, reaching the throat, voice box, and sometimes the back of the nasal passages. The reason LPR is so often missed is that it usually doesn't cause heartburn. Most people with LPR never experience a burning sensation in the chest. Instead, they experience symptoms such as constant throat clearing, a persistent feeling of mucus in the throat, the sensation that something is stuck in the throat, morning hoarseness, a mild chronic cough. Because these symptoms occur without classic heartburn, LPR is often referred to as silent reflux. A 2024 systematic review and meta-analysis found a significant association between LPR and chronic rhinosinusitis, a condition commonly linked to persistent postnasal drip and throat mucus. The research also highlighted an important factor that many discussions overlook. The problem isn't just stomach acid. The stomach also produces a digestive enzyme called pepsin. When reflux occurs, pepsin can travel up into the throat and become embedded in the delicate tissues of the voice box and throat. A 2024 study published in the journal Cytokine found that pepsin can trigger inflammation in voice box tissues, even when acidity levels are relatively mild. This helps explain why medications that reduce stomach acid don't always relieve LPR symptoms as effectively as they relieve heartburn. Once pepsin is present in throat tissues, even brief exposure to mildly acidic substances can reactivate it, triggering another cycle of irritation and inflammation. The body responds by producing more mucus. You clear your throat, but 30 seconds later, the mucus is back. This is where the issue becomes particularly important for older adults. After age 60, the muscular valve at the bottom of the esophagus, the structure responsible for keeping stomach contents from flowing upward, often becomes weaker and less effective. As a result, reflux becomes more likely. Lying flat at night makes it easier for stomach contents to travel upward toward the throat. Large meals, tight clothing around the abdomen, and excess weight around the midsection all increase pressure within the abdomen, making reflux even more likely. This is one reason laryngopharyngeal reflux, LPR, becomes more common with age. The body's natural defenses against reflux gradually weaken. If you've made it this far, you're clearly invested in understanding your health. Many people watch content like this, find it helpful, and then move on without subscribing. If you're finding value in these videos, consider subscribing so you don't miss future educational content. Throughout my years in clinical practice, I've observed one simple truth. Lasting health improvements rarely come from extreme measures. They come from consistently doing the right small things every day. That's exactly why I created the 30-day blood pressure reset for seniors, a step-by-step program designed to support healthy blood pressure through gentle daily routines, light exercise, and practical guidance that can be followed from home. I mention it here because high blood pressure and LPR often share similar lifestyle contributors. Excess body weight, poor sleep positioning, late-night eating, and chronic stress can worsen both conditions at the same time. Addressing these daily habits forms the foundation of managing both problems effectively. Many people who have followed this approach report feeling more in control of their health and more confident in their daily choices. For most, success didn't come from dramatic changes. It came from having a clear, simple plan they could consistently follow. Now let's discuss one of the biggest mistakes people make that allows LPR and persistent throat mucus to continue indefinitely. The most common mistake is treating the throat as if it were the primary problem. Many people with persistent throat mucus assume allergies are to blame and begin taking antihistamines. When those don't help, they move on to decongestants. When those fail, they try throat lozenges, saltwater gargles, or steam inhalation. While these approaches may provide temporary comfort, they all focus on the throat. None addresses the source of the irritation, the stomach. As long as acid and pepsin continue reaching the throat from below, the irritation persists, and the mucus keeps returning. The second major mistake is failing to adjust eating habits before bedtime. When you lie down shortly after eating, gravity can no longer help keep stomach contents where they belong. The valve at the base of the esophagus receives the least mechanical support when you're lying flat, making reflux more likely. This explains why symptoms are often worst in the morning. Many people with LPR experience reflux throughout the night while lying flat, leading to irritation that becomes noticeable upon waking. So, what can you do starting tonight? The first and often most effective change is to stop eating at least 3 hours before going to bed. Not 2 hours. 3. This gives the stomach enough time to empty significantly before you lie down, reducing the likelihood of reflux during the night. For many people, this single adjustment leads to a noticeable improvement in morning throat symptoms within a week. The second change is to elevate the head of your bed by 15 to 20 centimeters, 6 to 8 inches. This can be done using a wedge pillow or by raising the legs at the head of the bed. Lying completely flat is one of the most reliable triggers for nighttime reflux. Sleeping at a slight incline helps keep stomach contents where they belong and can significantly reduce reflux reaching the throat. Many patients notice improvements in their morning symptoms within just a few days of making this change. The third change is to reduce foods and drinks that can trigger reflux by relaxing the valve between the stomach and esophagus or increasing acid production. Common triggers include alcohol, caffeine, chocolate, fatty, and fried foods. Carbonated beverages. You don't necessarily need to eliminate these items forever. However, reducing them, especially in the evening, can significantly decrease nighttime reflux and the throat symptoms that often follow. The fourth change is to eat smaller meals more frequently, rather than consuming large meals less often. A full stomach creates greater pressure against the lower esophageal valve than a partially filled one. Large meals are among the most common contributors to laryngopharyngeal reflux, LPR, particularly when followed by lying down soon afterward. Now, here's an important point. If you've consistently followed these recommendations for 4 weeks and your symptoms haven't improved, speak with your doctor and specifically mention the possibility of laryngopharyngeal reflux, not just heartburn. You may also want to ask whether an evaluation by an ear, nose, and throat (ENT) specialist is appropriate. Unlike traditional acid reflux, LPR is often diagnosed through examination of the throat and voice box rather than through classic heartburn symptoms. Many people who struggle with chronic throat mucus for years finally receive answers when they ask the right questions and undergo the appropriate evaluation. Let's summarize the key takeaways. Persistent throat mucus in adults over 60 is often a protective response to ongoing irritation of the throat tissues. One of the most common and frequently overlooked causes is silent reflux, or LPR. In this condition, stomach acid and a digestive enzyme called pepsin travel upward into the throat without causing the typical symptoms of heartburn. LPR becomes more common with age because the valve between the stomach and esophagus gradually weakens. Eating close to bedtime and lying flat create ideal conditions for reflux to reach the throat during the night. The 4 lifestyle changes that often provide the greatest benefit are: stop eating at least 3 hours before bedtime. Elevate the head of your bed while sleeping. Reduce dietary triggers, especially in the evening. Eat smaller, more frequent meals. If you've been clearing your throat every day for months or even years and common remedies haven't helped, the source of the problem may be your stomach rather than your throat. Before we finish, consider this. Many people wait for the perfect time to focus on their health. In reality, that moment rarely arrives. Meaningful improvements usually begin with simple actions taken consistently. Whether you're addressing throat symptoms, blood pressure, sleep quality, or overall wellness, small daily habits often produce the greatest long-term results. If you found this information helpful, I'd love to hear from you. How long have you been dealing with persistent throat mucus? And were you aware that the cause could originate in the stomach rather than the throat? Thank you for watching. I'm Dr. Favor Adeyemi. Your throat has been trying to protect you. Now you have a better understanding of what it may have been protecting you from. I'll see you in the next video. Disclaimer: the information presented in this video is intended for educational purposes only and is based on published medical research and clinical guidance. It is not a substitute for professional medical advice, diagnosis, or treatment. Persistent throat mucus can have many different causes, some of which require medical evaluation. If you experience difficulty swallowing, unexplained weight loss, blood in your mucus, persistent hoarseness, or symptoms that worsen rapidly, seek medical attention promptly. The dietary and lifestyle recommendations discussed here are general suggestions and may not be appropriate for everyone. Always consult your healthcare provider before making significant changes to your diet, medications, or treatment plan, particularly if you have existing medical conditions or take medications that affect stomach acid production.